So the first counselling session is a session where we get to know each other. It's where introductions are made. It's where the student comes and presents what their issues are, their concerns are. They can also kind of ask questions about the counselling or what to expect. I think also what's important for the first session is kind of exploring goals, what they would like out of therapy, what would feel helpful. So I guess in a way it's kind of seeing if their difficulties are suitable for counselling and what kind of counselling would be helpful. Potentially also thinking about groups and workshops as well. I think the first session is about finding a shared language between the client and the therapist. So sometimes clients come to me and they say, I've got anxiety, I've got depression, and I don't know what that means because for everyone it's kind of different. So actually it's about a mutual understanding in the first session and really trying to find a shared language that I understand what you're talking about and you understand it, that I'm not making any kind of assumptions or kind of stereotypes, or I'm trying to understand from your point of view. So that's really important in the first session, is that shared language, really.
So basically from a first session, we're really looking to get to know you and get an understanding of what some of the difficulties you've been experiencing and about in what ways that we could help. So we're really going to get a lot of information from that one session, so expect a lot of questions. We'll also want to ask information about your family and about your support network, maybe at university but also back home. We'll ask about previous history of psychological therapies and your experience of them. So that's always helpful for us to get a sense of past experiences, if you've been with CAMS or a school counsellor, or even psychiatrists or GPs. We're also going to check basics around sleep, appetite, attention, concentration, and perhaps how the difficulties are affecting other areas of your life. We'll check also about if you're on medication and contact with the GP. Another area that's really important, but a difficult area for people to talk about, might be risk issues. So we'll ask about self-harm, and we'll also ask about if you've been having suicidal thoughts or if you've made plans. It's a difficult area and we're really aware that it is, so we try and put students at ease, and just to let you know, we spoke to lots of students with difficulties in these areas or similar experiences, so we'll try and help in the best way we can, put you at ease to talk about that. Another thing is we're not always looking to focus on the problems. We're also looking to think about, well, what's a student's strengths and what are some of the things they're good at. So we'll ask about that in your life, and I think as a psychologist I'd call those protective factors. So what are some of the things that are going well for you and that might help in your recovery from low mood or depression or other conditions? And that might be that you have a good boyfriend or girlfriend, or a good relationship with some of your friends or parents, or it might be that you have hobbies or interests that are a good way to distract you from some of the difficulties at times. Also, we might think about our other agencies important to involve, like GP and the NHS. So if we didn't think the counselling service is appropriate, we'd maybe have a think together about what other services might be important to support. We're not looking to label this, definitely. Not everyone that comes to counselling will meet criteria for a mental health diagnosis, and I think that's important to know, that we're not looking to label someone with depression. We might just gain an understanding of what the low mood, what's about the presenting problem, but not necessarily putting a label on it.
Lots of services ask students to fill out a form before they come, which shouldn't be a burden, and people don't have to fill out the form if they don't want to, but the more that they do, it helps us often triage and place people with the right clinician from the beginning. And the other thing is that we get a lot of feedback from students saying that it was really helpful for them to sit down and do an exercise thinking specifically what their difficulty was and what they would like to do about it. But don't worry if things feel too overwhelming or you're too distressed or to think about that, because that's what you can also do in the counselling session.
Advice for making the most of sessions is to think about what you would like. So a lot of students come to sessions saying, I want to feel better. And that's great. It's also quite a big goal. So in a way, it's kind of being realistic with what we can achieve. In a talking therapy, where all you have is each other and each other's words, how can we help you to feel better? And yet also, can it be like concrete, the goals, what would you like from the therapy? I guess it's to be open and curious, to be honest with what you want to talk about. That can be difficult in first sessions, but being honest and open is a great place to start. If you feel like you're struggling with the therapy or you've got questions, give honest feedback to the therapist. That's how you make the most of sessions, is to give that feedback. It's collaborative. There's kind of two people in the room. There's the client and then the therapist. Make the most of it by asking questions and being curious about it. The other thing I'd say to make the most of sessions is that silences are okay. In a way, it's a conversation. Some parts of it will be easier than others. It'll be easier than others, and that's okay.
I always encourage people to think about real change happens in between the sessions. So it's really important that any kind of skills or techniques that are taught in the sessions, that the student really makes an effort to practice them in between sessions, and I think that's where you'll see the real change and results. And it might be that you go and, like in a CBT approach, we ask students or young people to complete homework, and that might be that I might give you some thought diary sheets to complete, and hopefully in between sessions you'll spend time kind of reflecting on your thought processes, and that might mean that you keep a diary and that every day you fill that out. So it's not just about coming to sessions, it's about really putting into practice things learned in between the sessions, and I think that's when students will gain the most from therapy.
It's very similar, becoming sort of more mentally fit and developing our mental health is a bit like your physical health. So if you join the gym to get fit, you don't get fit by just going along and watching the gym instructor do all the exercises for you. You've got to get on the exercise machines and do some of the hard work.
Confidentiality is when we talk about something that it stays within this building between us. It sort of protects the students' material, what they say. But there are limits to confidentiality, so we will extend confidentiality if we're worried about the student, or if we're worried about someone that they're talking about, we might then extend confidentiality. So confidentiality will be extended with the student's knowledge and ideally with their permission. And the times that we do that is very rare. So usually confidentiality remains as it is in sessions.
Everything you say is confidential, except if I taught your risk to yourself or to someone else, and then I'd break confidence, but I'd always let you know.
There are some exceptions about confidentiality, but they are very extreme circumstances and very rare. So if a counsellor thinks that somebody is at extreme risk to themselves or at risk to other people, then that would constitute grounds to breach confidentiality, and usually what that would mean would be getting in contact with a medical profession such as a doctor or a psychiatrist. But as I said, that is a very, very rare occurrence.
But if someone was kind of really feeling a bit hopeless about counselling, or that nothing would really help, I'd be curious about that and want to look at that. But I wouldn't push counselling onto anyone. I think it's a student or everyone's choice if they want to engage in that intervention. And for some people it's really helpful. For other people, they might have really good friends they can talk to, or family. or they might read self-help books, or look up stuff on the internet, or engage in forums online, and that might be helpful for them. So not everyone needs counselling.
Some people say, will the therapy help me? I don't know, but that's the great and exciting, in a way, risk of therapy, is to see, well, what will happen together? We're two people trying to make sense of something. We can see what happens together, and we can try and bring some change together. So in a way, I think it's okay to have those doubts and concerns. In a way, there is insight, there's talking, and then there's also change, which is slow and not always easy. So there is hope. What I would say to people who said, I don't deserve to get better, or I can't get better, is you are more than your mental health label or diagnosis. Just because you have depression, if you do, doesn't mean you are always depressed. You can be much more than that. And if we just define ourselves in very narrow ways, we then don't live in a rich way. So what I would say is that our mind is neither our friend nor our enemy, it just is. Our mind will say all sorts of things to us. I'm not good enough, that's not good enough, why didn't I do that, why did I do that? I have those about being a good therapist, being a bad therapist. And in a way, I suppose it's about saying, right, I have these thoughts, what can I do about it? Who can I talk to about it, or what can I do about it? If those thoughts stop us from living the life we want, that's meaningful for us, then we can think about that together.
Sometimes I speak to a lot of students, and when they're having critical thoughts about themselves, at times when they really need to be kind and compassionate towards themselves, what happens is when they're feeling really low, this critical voice can become really active. And I try to say to young people or students, maybe think about how they would talk to a good friend that was experiencing difficulties. What kind of voice would they use? What kind of tone? What are some of the things they would say? And then I ask them to think about if they could practice talking to themselves like their own best friend. I think that's really important.
Well, I think the first is a lot of students, I'm noticing, are kind of medicalising how they feel, like they're calling it anxiety or depression. And in a way, maybe a tip could be to notice that it's okay to have these feelings, that actually part of us being human is to have lots of different feelings at different times. A tip would be not to immediately Google and look at all the symptoms, go, I've got depression, and then to label ourselves as that. But actually maybe to say, okay, what am I feeling, and who can I talk to about this?
Ripple tips. One thing I encourage with a lot of students is just to get the basics right. So sleep, appetite, eating 3 meals a day, regular meals a day, and maybe snacks in between. Exercise, getting out, not being in your room too long or in the library too long, definitely getting out, getting some fresh air, if that's a walk, a jog, a cycle, or even doing a class with friends, and using your support network. You're not alone with some of these difficulties. I'm sure there's other students or young people or people in your life that have had similar experiences to what you're going through. So I think it's important to communicate with others about what you're feeling and thinking.
Another tip is to say that if things don't work out initially, or things are going along well and then you have a dip or something goes wrong, don't be too discouraged by that. Remember that it is about momentum, so be compassionate with yourself, talk it through with your counsellor, and get back to sort of supporting yourself and encouraging yourself.